on the behavioral health unit at St. Peter's Hospital, and this is our dining room. We have a wrap put around it, we're so grateful to the foundation for helping us raise funds to be able to put this wrap here on our dining room doors. For our patients with advanced dementia, it's really important to have environments within our unit that create this immersive experience for our patients. They really feel like they're coming into a restaurant. For our patients, having these cues, it looks very familiar to them, and it can be reassuring and comforting to have a familiar setting as well. We were able to turn a space within our unit into a cafe. They're able to come here and feel like they're actually really going to get a coffee. So for them, this setting creates an immersive space where they can really feel like they're outside of the hospital. So they get to come here and really feel that experience. So with the foundation support, we were able to create a little hair salon environment for our patients. So one thing that the nurses do to try and encourage them or entice them to have their shower is to say, we'll be able to go to the hair salon after and get your hair done. Or after you have a shower, you'll be able to sit under the nice warm hair dryer. So right now we're in a dining room, which is also a multi-purpose room on the 2 east side of the behavioral health program at St. Peter's Hospital. And patients' families had identified that this room was in really dire need of renovations. So with the foundation support, we totally transformed the space into a garden. Nature can be calming for our patients, and so this gives them a feeling that they're in an outdoor space, even though they're inside. So we really had the concept of bringing the outdoors inside so our patients can experience nature even in the long winter months.
This is the family room, and it's a great space just for our patients and families to come in, even if they need to have a private conversation. It's a great space that they can use it for. It's also used by myself when I'm doing recreation therapy programs. Prior to COVID, we did lots of programs in here. There'd be social, special events, some games, programs, and crafts. Foundation funding has enabled the renovation of this family room space to be more home-like, and also the 2 lounge areas on the units as well.
So a few years ago, a former patient's spouse, through the foundation, donated some money to help renovate our physiotherapy gym. It has really changed what we can do and how much we do and how the space looks. So through the donation and working with the foundation, the physiotherapy team here really worked closely with the architects and the builders to really draw up what we wanted and how that could enhance patient care. And that went through looking at blueprints and even looking at samples of flooring to choose the color and the texture that we would like that was safest for our patients. So now the floor is a lighter, non-slip surface, and we have a lot of functional storage that's closed and neat and tidy. Patients are finding it a very positive place to work and have therapy. They really like coming into the gym. They get to achieve their goals here with all the work that's been done. So at the start of the pandemic, we really had a big change in the visitor policy. There were a lot of our patients who really disconnected with their families coming to visit, and not everyone here was able to call them. They didn't all have a phone at bedside or had their own personal phone. So through the foundation, we had the funds to set up a telephone station. So by setting things up in a nice London-style telephone booth, there's a section here where the patients can come use the phone, call their loved ones, and they can use that anytime.
What happens is a staff member up on the program will bring the patients down, they'll line them up at the window, and then their family comes to the other side of the window and they have a distance visit through the window. The patient here in the hospital can speak over the phone to their family who's on the other side of the glass. It's also created opportunities for patients to meet their new grandchildren for the first time in a safe environment, and that has been amazing to see. Back in the fall, some of the staff here at St. Peter's had the opportunity to plant some new trees in the courtyard. Now, staff and patients and their families get to enjoy watching these trees grow over the spring, and so that's been a great project that happened here at St. Peter's.